Hello, welcome to Holistically Speaking. I am your host, Marella DeVoe. This is our 100th show. Very excited to have passed that century mark. I always love reminding our viewers that our mission with Holistically Speaking is to be the avenue through which the voices of holistic health reach you at the time you need it most, so that you might all of a sudden learn of a new practice, a new therapy, a new practitioner, a new center that you might visit that might help you. And today I am joined by Bree Greenberg-Benjamin. Thank you for joining me.
Thanks for having me.
We have so many people in common, and I'm surprised that we have never met. But several people suggested that you would be a wonderful guest on the show. And we're going to be talking about integrative care for mental health, right?
Yes.
So what can we tell our viewers is integrative care so that we can start to set the stage for how this might help them?
Well, so I guess integrative care these days is a word or terminology that's used pretty broadly. So what I think about as integrative care may not be the same as what you think about as integrative care.
Right.
I think we used to use
It's like holistic too.
Yeah.
It means so many things.
Exactly. Yeah. And so I think it's based on people's perception and what their information is leading up to it. So I think integrative has come to represent these days sometimes what people used to call alternative medicine or complementary medicine.
Yeah.
But to me, it means something pretty different than that. To me, integrative means combining multiple modalities or understandings in order to provide an opportunity for treatment or healing that is very different than a unilateral approach.
Okay.
And so integrative to me means a big, full systemic picture of the client and of the treatment.
And what might be some of the different modalities, or what is in that system, that systemic treatment?
So, I mean, I think traditionally, you know, people in integrative care would say it combines body, mind, and spirit.
Okay.
And I think it could combine any kinds of disciplines that are applicable to that particular person's care, but in theory would represent aspects of those three unified elements, body, mind, and spirit.
And so, since I know that you apply this in the field of mental health, because we can think about, you know, body, mind, and spirit, you know, in the treatment of cancer, or, you know, how it affects digestive conditions, you know, stress affects your digestion, that sort of thing. So you are a therapist, family and marriage therapist, right? And so your field of practice of this integrative care is really in the realm of mental health, right? So how does it translate that body, mind, spirit approach into mental health?
So for me, and for the center, it translates from the base sense of just an understanding of the individual as they walk through the door. So not necessarily looking at mental health from a narrow lens of diagnosis like depression, anxiety, schizophrenia, bipolar disorder, whatever it is, but rather taking a full history of the person and looking at what their physical history is, what their emotional history is, what their family lineage is, as well as where they brought up with a spiritual practice. What are their belief systems? How resilient are they? So really looking at a big, broad understanding of that individual, how they're functioning in life now, what's in balance and what's out of balance, and how their system can look to attain better balance. Without forcing it, but by setting the conditions for better balance to arise.
Wow.
So much of treatment these days is about kind of getting people to do it different or coaching them to do it different so that they can theoretically like get to a better place, but that sets up the polarization of things which already are polarized. So what we're really looking for is more of a reunification process.
Well, what you're saying is making me think of, it's almost like you said coaching people to change things sounds like the acting technique of like fake it till you make it.
Right.
You know, and so where you're essentially, what I'm hearing from your saying in polarization is that maybe there's an inherent judgment that the way they are is wrong and they have to change,
That's
be coached to create this new way.
That's right, that's
Okay.
right. And which then just divorces themselves more from their current experience, right? So what we want to try to do is bring them more into their current experience and allow room for all of what that contains,
Okay.
rather than just saying this should be here or that shouldn't.
Okay.
Yeah.
So from the perspective of the person who's coming into the center, and when we say the center, we're talking about the Vermont Center for Integrative Therapy. No,
Yes.
Did I say that right?
You totally said it right.
Okay.
It's a mouthful.
Yeah. So somebody walks into the Vermont Center for Integrative Therapy, and you described a really thorough, broad type of an assessment, perhaps, of all these different areas. So what does that look like for an individual who's choosing to explore integrative therapy as an approach?
So we call it our integrative care consultation, and it's free to everybody who walks through our door. It's about an hour long. And the first 45 minutes, we have an intern who goes through a long questionnaire that asks about physical body, mental body, emotional body, spiritual body, and energetic body. And so we're asking questions about all of that, as well as what's bringing the person in. How is their functioning at that moment and at that time? What's driving them to seek us now?
Yeah.
And then in the last 15 minutes, I come in and I talk to that person a little bit about what their goals are, and then I make recommendations about what kinds of care providers we may have to support them to get to those goals, whatever they are. Sometimes I refer people out of house. You know, sometimes people come to us and I say, you know, we're not the right fit for you.
Okay.
And other times I may say, you are coming in asking for talk therapy, but that's not really going to be the most effective way to get you where you want to be.
Gotcha.
You know, when we think about mental health care these days in our culture, we still think very narrowly about talk therapy. But that's only one aspect of intervention. And in fact, it's a very incomplete intervention.
Yeah.
And so what we're looking to do is a much more complete intervention. So we can form a team for people that includes something like a chiropractor.
I was just going to ask you that. Okay.
A chiropractor, a craniosacral person, a nutritionist, a psychiatrist, a psychotherapist, an individual yoga instructor who is trained in doing like trauma yoga interventions or anxiety-related interventions, a meditation instructor. We also have some family medicine in-house, and shortly we'll be joined by a naturopathic doctor as well. So there's a lot of options for people.
And what do you mean by family medicine?
Yeah, so just like general family
So
medicine.
like your old school doctor.
Exactly.
Okay.
But, well, with a new school twist.
With a new school, yeah. Yeah, I'm just thinking of the traveling doctor with the, visiting the, the family doctor. So then someone who's coming through your doors is going through this very thorough assessment, and then will potentially work with everyone or some of those?
We'll select.
Okay.
So at the intake, I'll be talking to people about what I recommend and what I think can be helpful. And I'll also say to them, these things can be helpful now, but maybe in the future you'll do these.
Right.
We also have a pretty small, about 400 square foot yoga center right in the center of our office space. And so in our yoga studio, we run diagnostically specific yoga programs. So we may run a 6 or 8 week or 12-week series for anxiety or trauma or chronic pain or IBS or things like that.
Interesting. So that's the perfect segue, because the next thing that I wanted to ask you is, the people who are naturally inclined to come through your doors, are they people with more of the mental health challenges, that they're maybe experiencing anxiety or depression or stress or, some sort of trauma? Or do you also get people with digestion issues?
Everything.
Interesting.
We get it all. I would say the vast majority of people are ones who are struggling with some sort of mental health component. And also people who are looking to just go deeper in their journey. Like they want to understand themselves better, and from a more complete understanding. Maybe they've had a narrow lens of treatment in the past and they've always wondered about what more there is that's going on. Or maybe they have somatic manifestations of mental health stuff like chronic pain, fibromyalgia, and they want to understand how that fits in a complete picture.
So I know the answer to this, but I want to ask you because I want our viewers to understand what happens once somebody comes to work with you and says, all right, I definitely want to work with this integrative approach, and gets assigned to maybe a nutritionist and a yoga teacher and a family therapist, perhaps, and energy worker, I don't know. So they have these practitioners. So how does that care look like for that person? Is there conversation between the practitioners? How does that happen?
So once people come in and we've agreed upon an initial care plan for them, then our front desk will process their intake by farming them out to all of the practitioners who then are on their team. Those practitioners then know they're on a team for that particular client. They'll start seeing that client individually, and then once a month they'll come to our team treatment meetings all together. Sometimes with the client, sometimes without the client.
Oh, interesting.
And we'll
they
all
meet together.
and we'll all talk as a team about where that client is in their progress, where we think things need to be tweaked, if we're still really paying attention to the goals that we're supposed to be, just kind of all staying on the same page.
That's really wonderful. And how do people respond to having this kind of team meeting with all of their practitioners?
I mean, some people are pretty intimidated when they come, but I think most people who do come, they love the opportunity to be able to participate in their care in that way.
Yeah.
And I'd say it's about 10% of the time that people come to those meetings.
Okay.
The rest of the 90% of the time, we're just meeting as a team.
Yeah.
And as the clinical director, I try to be at all of those team meetings as well.
Okay.
It's kind of neat because all of the care providers, you know, they all have their own perspectives on how they're seeing the client based on their perception, but also based on their own discipline of understanding. And so I get to sit in as the clinical director and try to weave all those together, kind of keep everybody on the same page. It's fun for all of us.
Yeah. I absolutely love hearing you say all of that, because just before the show I was sharing with you that I started off my coaching counseling career with a master's in counseling, and I was doing mental health and all of that. And I remember just feeling like I want to ask them what they're eating. You know, I can't work with someone who's experiencing anxiety or depression or whatever and not know if they're binging on sugar or, you know, or junk food or whatever. I need to know what they're eating, and this is exactly what you're doing.
Well, and the beauty of it is that not only do we know that stuff, but we have specific disciplines that have expertise in that area. So, you know, I could say to our nurse practitioner, can you order a hormone panel on this person? And can we know what's going on with their cortisol levels? And so then she brings that information back to us, and it informs our understanding. You know, I think as psychotherapists, we often have such a kind of hammer and nail understanding of people, right? It's like they come in with these symptoms and we think that it's from their childhood or something. But lots of times it has nothing to do with that, or that's just one aspect of how it's manifested. And so in this way, we try to provide a more complete picture to the client, which translates as a less judgmental approach as well. It's not so much of that, like, you need to heal these old wounds. And if they are there, we find them and work that piece as well.
That's beautiful. So Bree, you started this center here about 4 years ago, it was? So how is this your brainchild that you came up with, or how did you experience this somewhere else before you moved to Vermont? So how did this emerge?
It was really interesting. About maybe 16 or 17 years ago, I was practicing as a psychotherapist shortly out of school, and I got pretty ill. And no one could figure out what was going on with me. I went to lots of Western medicine physicians. I went to lots of acupuncturists. Nobody knew what was going on. Finally, they gave me a diagnosis, but they couldn't do anything about it. And so I started wondering how to work with that. And eventually dropped out of being a psychotherapist for about a year and intensely did lots of yoga. And then found that that was helping certain aspects, but not really changing some fundamental issues. And a good friend of mine at the time said, you know, Bree, you should become macrobiotic. And I was like, what is macrobiotics? And so she said, oh, my sister did it for endometriosis, and she never had to have surgery. I'll teach you. And she did, and within 3 months, I was radically better. And so I started kind of formulating this idea of a place where all of this could live together.
Yeah.
At the time, I was also treating young women with eating disorders and finding that the services that I was offering were not working in a complete way.
Yeah.
And so when I came back to being a psychotherapist, I thought to myself, well, if yoga and macrobiotics has helped me this much, wouldn't it help them?
Right.
And so I started thinking about a way in which we could really offer that collectively. And then it just took a lot of years to manifest.
I can imagine.
Yeah.
So did you start a similar center somewhere else before you moved to Vermont, or it was just finally in Vermont that everything came together?
Totally.
So what are some of the different practitioners that you were able to bring together to create the center?
So initially I had a business partner, and she was a psychotherapist. She is a psychotherapist. And we started with a bunch of other psychotherapists and a nutritionist and a body worker and a few yoga therapists. And that was kind of where we began.
Yeah.
And it's really grown since then to representing, I think, more disciplines and a more complete picture for people.
Gotcha.
Yeah.
So I love asking my guests, what are some of your favorite stories that you've seen of people just completely transformed? Typically the example is, so someone was really stuck in one place after trying so many things, and now then they tried this approach, and they were so much better. Do you have a story like that you can share with us?
I don't know if I have a specific story like that. I feel like the stories that come up for me are, I guess, the people who I see on a weekly basis who say this place has helped me so much and it feels like my home. It feels like a place that I can come and really discover myself, and that I feel safe and known and treated really well. There's so many people who have come through our doors who say that they were stuck before they came, and now they feel a lot of movement, and they feel that without the conditions that we have provided, they would never have had that movement, and it is across diagnoses, and really across practitioners.
Yeah. So one thing that it's almost like I'm in our viewers' heads and thinking, I think somebody's probably wondering, is this something that I can use insurance for? It's like, is this part of, are you in kind of the system where you can actually, people can come to you for their mental health, their nutrition, their...
We are. Yeah, we're in the insurance panels with pretty much every major insurance company that people have in Vermont, and some out-of-state policies as well. Of course, there are things that aren't covered, like yoga therapy is not covered, and body-based work is not covered. So, no Reiki or integrated energy work, no massage in general. But our nutritionist is in network, and our psychiatrist is in network, and all of our therapists are in network. Our naturopathic doctor will be in network.
Oh, wonderful.
Yeah.
And so do people usually get a referral to come see you, or do they just say,
this
just sounds great and I want to come here?
They just come, and we also, I think, get more and more referrals now, interestingly, from doctors' offices. I think from physicians in the area who feel like they see patients who keep coming back and thinking it's a physical thing, but it's a more complex issue that's going on, and so they send their patients to us to look at that complexity.
So what are some of the things that viewers might be watching us and experiencing, X, Y, or Z problem or complaint that typically would do really well at the center?
Things like IBS, fibromyalgia, depression, anxiety, trauma, eating disorders and other addictions, sleep issues,
really? That's
pain issues,
and
headaches.
Oh, headaches! They can be so stubborn for so many people. Well, like
and of unknown etiology.
Yeah, exactly.
Yep.
And it's interesting because I have had many clients with headache issues, and sometimes you can figure them out nutritionally, and sometimes it's something stress related, sometimes it's hormonal, just so many different things.
Yes.
So in the approach and your experience seeing this work together, just work for your clients, the question that's formulating in my head is, what's missing for more of the medical community to to embrace more of this approach, or, you know, is that a fair question?
I think it's a fair question. I'll see if I can answer what you're hoping for.
I'm really not even sure, but it's...
I mean, I think I didn't quite understand before I opened the center the level of dedication and complexity it takes to deliver true integrative care. So I think as an outsider, just thinking about what care should be, or what I think care optimally could be, I had a lot of presuppositions and judgments about why the regular community wasn't doing that. And now what I really understand is that they're not doing it because you don't get paid for a lot of it.
Right.
And so you need a whole staff that's dedicated to the idea of
Having
these
team
values.
meetings and,
Precisely.
Yeah.
And so I think we're just not set up to look at etiology, to look at preventative care, to really understand a person's system in its fullness. And certainly there's more and more of that happening in the medical community, from the hospitals all the way down to private practices.
Right.
But I think it's still happening in a segregated way of, like, the medical practices that are doing it from a very body-based standpoint still.
Yeah.
And mental health is kind of thrown in there as like some sort of extra.
Yeah.
But it's not really fully understand for the power that it has over a system.
Right.
And so if somebody has a trauma history and it hasn't really been fully attended to, all the integrated medical care possible is not going to really fully unearth some of that unless you've got some really good trauma treatment going on that's body-based as well.
Right.
So I think there's just still these fissures in our understanding and in our communication.
Yeah. Well, and I think what you're saying is also highlighting for me that the main framework of how we've typically looked at both healthcare and mental health is that you have an elbow doctor and you have an ear doctor and you have a knee doctor and you have a head doctor.
Totally.
You know? So because we still look at it as so this individual instead of seeing a whole person, it's just so fragmented.
That's right, that's right. And we're not taught to do that.
Right.
You know, I certainly wasn't taught to do that when I studied psychotherapy. My husband's a physician, he wasn't taught to do that.
No.
And so I think it has to start from that place.
Right.
And I think there's some inroads there, but it's certainly not the norm.
Yeah.
And I think we're a long way off from that.
Yeah, and do you see the potential for a new field emerging where eventually there will be practitioners that, I don't even know what I'm imagining, but do you see a new field, or is it always going to be a coalition of these experts?
I think it would be a coalition maybe, but with more common understanding and maybe more common goals, not so divisive as like Eastern medicine and Western medicine like it is now. I hope so anyway.
Yeah, I hope so too. So I want to rewind to the beginning because there was something that you said about the assessment that got me kind of curious, and then I thought, well, there's all these other things that are really important to talk about, but I want to rewind to that first assessment when someone comes in and you said there's the mental health assessment, the mental, emotional, physical, energetic. So I can kind of picture all of the, I can picture the physical, you know, what are you eating, what hurts, what doesn't hurt, you know, that sort of thing.
How do you sleep? Right.
What else is in that physical? I guess I want to skip to the, I want to get to the energetic one because I'm really curious.
Everybody always asks about that. How are you assessing that in a questionnaire?
Exactly. So, but let's touch all of them. So the physical, you're asking about nutrition, sleep, energy levels.
Headaches. Stomach aches, general pain, back aches, all that kind of stuff. Car accidents, concussions.
Oh, yeah.
Any kind of big ticket items, basically, that would set off my curiosity. Surgeries.
Yeah, body trauma.
Precisely.
What about the emotional?
Yep, so I'm going to ask about their tolerance for emotions like anger, sadness, grief.
Okay.
I'm going to ask about their general emotional life and what leads.
Okay.
Yep.
Was there a separate, is it mental and emotional the same, or is there a separate, I don't know.
Mental is more around cognitive functioning. How's their memory? How's their focus? Some of that I ask about, and some of it I'm just paying attention to.
Right.
Can they really stay with the questions? Are they trailing off? How collected are they in the interview?
Gotcha.
Yep.
And so the energetic, assessment, what are you looking for? What are you assessing?
So I'm asking about their dream life, how active or inactive it is, how many nightmares they have, whether those are concurrent nightmares from childhood. I'm also looking at how their energetic presence is in the room.
Yeah.
Are they big or small?
Right.
Does it feel very fragmented or very collected?
Yeah.
Do they make good eye contact? Are they able to kind of hold their energetic space, or do they feel boundaryless?
Right.
And then I'll ask questions about that.
Yeah.
So if it looks like it's fairly contained, then I'll say, things like, can you let people in? How's your receptivity?
Right.
So I'll just poke around in there a little bit.
Fascinating. And then you also, I'm forgetting what were the words that you used. They're almost like an environmental assessment, or kind of I'm not sure if that's the totality of your assessment, but what have we left out?
I guess we've left out questions about trauma history, family lineage type stuff, like addiction history.
Yeah.
Those are pretty important ones. Current life situation, current living situation, current stressors.
Got it.
All of that.
And so then once someone goes through that whole assessment, then you formulate a plan with a team, you assign a team?
Precisely. And then the client has, of course, full choice that if they meet with anybody or all people on that team and they find that it's not the right fit, they just let me know, and then I'll make shifts accordingly.
And they meet, I would assume they meet with certain regularity with each one of these practitioners.
Yes.
Is there a certain amount of time that's a minimum that you would say we typically work with people for 3 months, 6 months, a year, or not really? Is it just kind of an ongoing relationship?
It's an ongoing relationship, and I usually encourage people to stay at least 3 months to really be able to kind of see what's going to happen. And we try as a team to reevaluate goals for the client every 3 months. So we try to kind of write 3-month goals, stay on track for them, and then reassess and change them if need be.
And are they meeting with each one of these practitioners on a weekly basis, or once a week? How does that rhythm work?
Some of it has to do with finances. So ideally, lots of times people would meet with these folks weekly. But they may say, I can't afford to do that.
Right.
So we do have plans that try to make it more affordable to people. We sell packages. We've come up with all kinds of ways to make it affordable for people.
Wonderful.
And we also have a Donna Fund, which is our scholarship fund for people who need out-of-pocket treatment but can't afford it, and will help cover some of those expenses as well.
Oh, wonderful.
Yes, we haven't turned anybody away yet.
Oh, excellent. It's just such great news. And I want to be sure to show our viewers how to contact you, because I just think this is such a fabulous resource that you are to people, that I want to be able to show them. So if you're interested in visiting the Vermont Center for Integrative Therapy, this is their website. It's vtcit.com. You want to write it down. It's vtcit.com. That's for Vermont Center for Integrative Therapy.com. Is there anything else that you feel needs to be said in the last 30 seconds or so?
I guess the last thing I would say is that what makes us really unique is that, not only do we incorporate yoga, not only do we incorporate meditation, not only do we incorporate all these wonderful disciplines, but the foundation of our understanding of people is based on those ancient practices. And I think that's what makes us really unique, is that it pervades our understanding as well as our delivery of care.
That's wonderful. So it's ancient, but the other thing too that I've really appreciated is, oh, that's my timer saying that we're out of time. So the integrative approach and really looking at the person as a whole. So I hope you found it just as fascinating as I have, and I was so happy to have you. Thank you for joining me.
Thanks, Marilla.
See you next time.